Hello everyone, my name is Chad Ift. I'm one of the exercise specialists in the fitness center. Today I would like to discuss with you the changes in sleep and as you age. We all look forward to a good night's rest. Sleep allows our body to rest and restore its energy levels. Without enough restful sleep, not only can we be grumpy and irritable, but also inattentive and more prone to accidents. Like food and water, sleep is essential to good health and quality of life. As people age, they tend to have a harder time falling asleep and staying asleep. Changes in the patterns of our sleep, which is called sleep architecture, occurs as we age, and this may contribute to sleep problems. Sleep occurs in multiple stages, including dreamless periods of light and deep sleep, and occasional periods of active dreaming, which is also called REM sleep. Older folks spend more time in the lighter stages of sleep than in the deeper sleep. Studies on the sleep habits of older Americans show that an increase in the time it takes to fall asleep, which is called sleep latency, an overall decline in REM sleep, and an increase in sleep fragmentation, which is when you wake up during the middle of the night as we age. The prevalence of sleep disorders also tends to increase with age. Sleep disturbance among the elderly can be attributed to physical and psychiatric illnesses and medications used to treat them. Other factors affecting sleep are the circadian rhythms that coordinate the timing of our bodily functions. Older folks tend to become sleepier in the early evenings and wake earlier in the morning compared to younger adults. This is called advanced sleep phase syndrome. It is not clearly understood why these changes occur. Insomnia is also higher among older adults. 44% of older folks experience one or more of the nighttime symptoms of insomnia, at least a few nights a week or more. Insomnia can be chronic or acute and is often related to an underlying cause, such as a medical or psychiatric condition. The primary cause of sleep disruption for 90 million American adults is snoring. Snoring is most commonly associated with people who are overweight, and the condition often becomes worse with age. Snoring can be a symptom of obstructive sleep apnea and is associated with high blood pressure and other health problems. Breathing stops for as long as 10 to 60 seconds, and the amount of oxygen in the blood drops, often very low with sleep apnea. This can cause multiple sleep disruptions throughout the night and result in excessive daytime sleepiness and impaired daytime function. Untreated sleep apnea puts a person at risk for cardiovascular disease, headaches, memory loss, and depression. Another sleep disturbance is restless leg syndrome. This is a neurological movement disorder characterized by an irresistible urge to move your limbs. Gastroesophageal reflux disease is another common cause of sleep problems. The pain also makes it difficult to sleep. Medical conditions such as diabetes, renal failure, asthma, and immune disorders are all associated with sleep problems. Diseases such as Parkinson's and multiple sclerosis can also cause sleep problems. Now, let's talk about ways you can help promote sleep. First, let's try to exercise at regular times each day, preferably in the afternoons. You want to avoid stimulants such as caffeine for about 3 to 4 hours before you go to bed. Caffeine is a stimulant that may keep you awake. Try to go to bed at the same time every night and wake up at the same time every morning. Use your bed and bedroom for sleeping alone. Avoid alcohol and cigarettes late in the evening. Try not to nap as much during the day. If you do take a nap, make sure it's under 30 minutes. Try not to worry about your sleep. The more you worry, the harder it may become to fall asleep. Create a safe and comfortable place to sleep. If you're getting healthy sleep on a regular basis, you should feel alert during your waking hours. One of the main symptoms of all sleep problems is daytime sleepiness. Sometimes sleepiness will manifest in other ways, such as loss of memory or concentration problems. You may also feel irritable, depressed, or a bit confused when you are sleep deprived. If you are experiencing difficulty sleeping, consider whether an event or particular stress could be the cause. If so, the problem may resolve in time. If not, talk with your doctor about your symptoms. There are a number of behavioral modifications you can make to establish healthy sleep. Some of the modifications are conditioning people to use their bed and bedroom for sleep only, like discussed earlier. Therapy to help modify attitudes and beliefs that may contribute to poor sleep. Relaxation training. Restricting time in bed if you are spending too much time laying awake. Some common prescription sleep aids include hypnotics, which induce and maintain sleep. They work by acting in the areas of the brain believed to be involved in sleep promotion. Antidepressants, if the cause of sleep problem is depression. Anti-anxiety drugs, if anxiety is related to insomnia. Now let's discuss some data about sleep and aging. 24% of those ages 65 to 84 have been diagnosed with 4 or more medical conditions. Of this group, 80% reported having a sleep problem. Older adults were found to have more consistent sleep patterns for both weeknights and weekends. Persons of the ages of 55 to 84 sleep on an average of 7 hours of sleep during weeknights and 7.1 hours on weekends. A study of adults over 65 found 13% of men and 36% of women take more than 30 minutes to fall asleep. Older folks often sleep less deeply and wake up more often throughout the night. And finally, older adults need on average 7 to 9 hours of sleep per night. That is all I have discussed with you today about sleeping as you age. Thank you for joining me, and take what you have learned and get a good night's sleep tonight.